So we just presented an abstract that looks at the longitudinal single-cell profiling of the immune system of patients receiving Teclistamab, specifically in two groups of high-risk smoldering versus relapsed myeloma. So immunotherapy, specifically bispecific antibodies, have really made significant advances in the treatment of myeloma, and one example is Teclistamab that was approved recently. However, we had the hypothesis in mind that patients with smoldering myeloma have less altered immune system and lower tumor burden as compared to those more advanced in the disease spectrum. So this drug was studied in this population in the ImmunoPrism trial and showed to have overall response rate and MRD negativity rate of 100% in the first 12 patients. So we wanted to see what are the immune characteristics and the immune factors of the peripheral blood that could explain the better and the deeper responses seen in the high-risk smoldering as opposed to the relapse. So for which purposes we put together a cohort of for around 40 individuals. We had healthy donors as well as patients with high-risk smoldering and relapsed myeloma, and we studied their peripheral blood before and after Teclistamab. At the baseline, we could identify significant differences in the immune composition between high-risk smoldering and the relapse. For example, we saw that the patients with relapsed myeloma had higher exhausted-like cells, higher C1q macrophages, as well as lower CDC1 cells compared to the smoldering that plays a key role in activating CD8 T cells. Then we wanted to see if we can see if any of these baseline characteristics can be associated with the response to Teclistamab, and we could identify a population of exhausted-like cells that express markers of exhaustion, such as TIGIT, TIM3, CTLA-4 across patients, and its percentage was significantly higher in our non-responders in the relapse group as opposed to the responders in both relapsed myeloma as well as high-risk smoldering. So after kind of studying the baseline characteristics and doing this association with the response, we then looked at how the immune system is reacting post-Teclistamab, and whether, again, if there are differences between high-risk smoldering, who are 100% responders, versus relapsed myeloma, which are around 62% of them were responders and the rest were non-responders. And we saw that in high-risk smoldering responders group, we saw a significant clonal expansion of T cells in the post-treatment compared to the baseline settings. We saw similar trend of increase in the responders of the relapse. However, in the non-responders group, the changes were mixed. We also see that post-treatment, there is a significant increase in the percentage of the granzyme B CD8 T effector memory cells that was significant in the responders of high-risk smoldering. Similar trend of increase in responders of the relapse, but again, mixed changes in the non-responders groups. So to conclude, we would first of all able to see significant differences between high-risk smoldering and the relapse when it comes to the immune composition of the peripheral blood. We could identify these exhausted cells exhausted-like population of cells, and we found that it is significantly higher in the non-responders group in the relapse settings as opposed to the responders of the high-risk smoldering. And finally, we also identified post-Teclistamab immune changes, whether with the clonal expansion of the T cells or increase in the percentage of this granzyme CD8 T cells, to be associated with the better and the deeper response seen in high-risk smoldering as opposed to the relapsed myeloma.